Well, here we are once again on Wednesday. So that
Yes.
must mean it's Wellness Wednesday. So welcome to the Health, Wellness, and Lifestyle Program with Linda Dorman and Dr. Donna Christensen on our TV.network. And we also broadcast on Apple TV, Amazon Fire Stick, Roku, Tempo Television, and WSTX Radio Bloomberg out of the beautiful island of or nation of the U.S. Virgin Islands. So
Mhm.
I'm broadcasting from Maryland. And where are you this week, Donna?
I just got into Washington last evening, so I'm in DC,
You're in
heading
the
to Philadelphia for a
DMV.
meeting in Philly this weekend, and then back
Wonderful.
home.
I tell you, to be a retired congresswoman and family physician, and I think the word retired is pivotal. You don't seem to be very retired.
No, I'm gonna slow down a little bit though, getting ready to do something to focus on something at home
Well, that's
and cut back
wonderful.
on the traveling.
And home being the U.S. Virgin Islands.
Yes, St. Croix in particular. Yeah.
In St. Croix in particular. Well, you've been such a stalwart in this entire legislative and public policy around health and just really being a champion for it, putting your career in that process. So we thank you for that. If we've never said thank you, let's just say thank you right now because it's so important. It's so vibrant that you've spent your additional years outside of the House of Representatives, still fighting and pushing and doing well. And I know our guests, we're going to talk about
Yes.
healthcare public policy as a segue. So let's bring them in. And can you do the pleasure
Sure.
of introducing them?
And just as for them, it's been for me a labor of love, and we're just really happy to have both Dr. Anel Prim and attorney Enola Aid with us today. And
Fantastic.
they can
Welcome,
give you
ladies.
a brief bio.
Thank you.
Wonderful.
Great to be with you.
Well, we appreciate your being here. And, often we talk about different health issues. And then we've talked about the impact of those who are surviving with something like a heart disease or organ transplant. We've heard from the voice. We have talked about public policy and the things that impact in technology, health equity, just how we get laws made in this country that's going to push the dial and give us what we need. Certainly, the Affordable Care Act has been a very robust conversation over the 2 years we've been doing the program now, which is hard to believe that we're in almost 2.5 years. But this is a subject that never gets old for me because it's a subject that's so dynamic, and that's health policy. But before we get started, love to have Dr. Christensen share with us your backgrounds.
Sure. And this is a departure from, for our two guests, let me say, this is a departure from what we've been doing for the last couple of weeks. We've been focusing on men's health because we felt might have been feeling a little left out because so much of what we talk about has been about women. But it's a very appropriate discussion for this time of year as we're still in hurricane season and many of our communities are still suffering the after effects of recent disasters. Dr. Anel Prim is the Senior Medical Director of the Steve Fund, which supports mental health and emotional well-being of young people of color from adolescence into young adulthood. She believes strongly in the mission of the BMHA and has dedicated her professional and volunteer efforts to fostering the well-being of Black and other communities of color. She's a community psychiatrist with a community background in public health. She's the co-editor of several books, and she has a medical degree from Howard University College of Medicine and did her residency in psychiatry and public health at Johns Hopkins. And attorney Aird is an activist mother, a former corporate lawyer. She's worked for the Children's Defense Fund, leading its violence prevention initiative, something we could talk about in another session, and serving on acting director of its Black Community Crusade for Children. She's a Phi Beta Kappa graduate of Barnard College, earned her law degree from Yale University. She was born in Panama, which makes her one of our fellow Caribbean Americans, and attributes much of her vision and passion for the movement for emotional emancipation to stories passed down in her family from her great-grandfather, Samuel Aline, a loyal follower of Marcus Garvey. But This is going to be very interesting and, as I said, very timely. And maybe we could begin and by asking you about the All Healers Mental Health Alliance and how it got started. And then we'll ask Dr. A to talk about how her Circles of Healing, Community Healing Network got started.
Okay, well, thank you all for having us, and pleasure to be here and to speak about the All Healers Mental Health Alliance, which is a group of health professionals and faith leaders, first responders, and community health advocates that came together immediately after Hurricane Katrina in 2005 because of what we were seeing on television was just horrifying, seeing our people suffering and struggling. And that particular disaster really lifted the veil on what was perhaps hidden before, some of these systemic and structural inequities that Black and other historically marginalized communities experience. And a disaster as horrific as Hurricane Katrina really exposed that. And we felt, as concerned community members, that we needed to do something about it. And so what we did at that time, we had the impulse to go running to the New Orleans and the Gulf Coast. That was certainly not the thing to do, but we figured out what we could do from a distance, remotely. And at that time, we were using regular telephone conference calls, meeting every Sunday evening to think strategically about what could be done to facilitate culturally aligned, culturally grounded, culturally affirming responses to the mental health needs of people affected by disasters. At that time, of course, natural disasters, but we began to realize that we needed to expand that to human-caused disasters as well. And of course, what ran through everything is racism. That was the common thread that was playing out in each and every disaster. So we've been meeting at least monthly ever since. So that's been 17 years.
Yeah. And Attorney Aird, how did you get started and when?
So I'm here representing Community Healing Network, and it is a pleasure to be with all of you. Thank you, Annelle. Thank you, Donna Christensen. Thank you, Linda Dorman, Dr. Annelle Prim. So Dr. Annelle ended on the subject of racism. And so we are at Community Healing Network concerned with the root cause of anti-Black racism, the root cause of systemic anti-Blackness. That for us is the lie of white superiority and Black inferiority. And so Community Healing Network is mobilizing people across global Africa to heal from and extinguish the lie of white superiority and Black inferiority. Why? Because it is really at the root of every single challenge that we face. And until we deal with it, we'll continue to deal with these other problems. The lie really established a hierarchy of humanity that says that white people are at the top of the human chain, and that Black people are at the very bottom, and sometimes not even in the human family at all. We've got to come to terms with the fact that that is the reason why we are so often dehumanized in every system that we encounter, in the health system, in the educational system, in the housing. Everything that we deal with is driven by this notion that we are not like the rest of the people in this world. And so we've got to grapple with that problem. We've got to face it head on. We have developed a number of strategies to build this global movement, because it's not a problem that just affects us here in the United States. It affects us in Panama and in Barbados and Jamaica and in Ghana, in South Africa. And we have actually, through the great offices of the Association of Black Psychologists, deployed we believe, groundbreaking self-help support group process called the Emotional Emancipation Circle, which is focused specifically on how do we come to terms with the fact that not only does the world look at us through the lens of this lie, but we often look at ourselves through the lens of the lie. So how do we do the work necessary to free ourselves and then free our children, and then figure out how we can get rid of this lie in the world? Anything that is created, and it was created some 600, 700, 800 years ago to justify the enslavement of African people and the exploitation of the African continent. Since it was created, it's a device that human beings created. It is a device that can be destroyed, and that is our intention.
That's critical. You know, the statement that you made is that it's our intention to eradicate this false understanding of who we are, because it has been so baked into, I propose it has been baked into our DNA. It's been passed on, has been part of our cultural trauma. And I don't think that people understand that trauma has a footprint, an imprint, and it carries through. We think of it in not in those health terms or the science terms, but I believe that to be true. And because of that, we're walking functionally into these representations of ourselves that are in fact false representations. And it carries over into our healthcare system, that now we're seeing the challenges of of those issues. Like if I say as a Black woman and I'm pregnant, I am in pain,
Yes,
I'm having problems, and I'm having some issues. We just talked about this with another organization in cardiac. I'm experiencing a cardiac incident that actually rises up to a full heart attack, but no one's believing me. They're not putting me on an EKG machine. They're not reevaluating me and sending me home thinking, well, you're just having some minor contractions, come back. You're having a major event. Why is that represented? Why are we not what's happening inside of us that we're not advocating even more, that we're accepting of it?
right.
Is the superiority part of it that I feel very concerned about. Not to put the full responsibility on a patient walking into a hospital with an event where they're relying on their healthcare system. But what you've just said is so powerful in the intent and the misrepresentation that we have accepted on some unconscious level.
I should say also that we've set a deadline on ourselves. 2021 to 2030 for us is the decade to defy the lie of white superiority and Black inferiority, and to embrace the truth of Black humanity. We think that this has gone on long enough.
Mm-hmm.
You know, this lie has a power because it's invisible, right? It's just there. I mean, we ended enslavement, we ended colonialism, we ended apartheid, we ended Jim Crow, but the lie has been there all along. It's what's driving everything. It's when you ask for the question, what happened to George Floyd? Why was he so deep? Because he is seen as less than. What happened when we had a Black president in the White House? What were the caricatures of that person? Mm-hmm. What happened? What was unleashed that we're still living with today, right? And so for us, this question of, it happened a long, long time ago. But interestingly, and I won't belabor this point, it happened a long time ago, but it was meant to be perpetual. When the Portuguese launched this transatlantic trafficking of African human beings, they went to the popes, and the popes gave them, carte blanche. You can do whatever you want to do with these people in perpetuity. And the instrument of the in perpetuity was this lie. So if many people have been trafficked and enslaved and colonized in human history, but we were unique in human history because it was done with the instrument of this lie, which became an instrument of our continued oppression. And so it will continue until we stop it. And that's what our movement is about.
So and it plays over into the what AMHA tries to do, especially in responding to different kinds of disasters. And I know we've worked with Flint when we had a major closure of one of our major industries in the Virgin Islands. I turned around and they were there. And of course, they've worked with us during hurricanes. But the way this lie works in disaster also leaves Black communities floundering. Anel, you want to talk about that and maybe a little about our last meeting?
Yes, and I would like to draw a connection with what Laird was saying and talking about the Community Healing Network, because the All Healers Mental Health Alliance, of which the Community Healing Network has been a part, one of the collaborating organizations, I've seen them, Community Healing Network, as a solution for some of the healing strategies that the All Healers Mental Health Alliance has applied to disaster situations, like the aftermath of the killing of George Floyd, of Michael Brown in Ferguson, Missouri, and Freddie Gray in Baltimore, Eric Garner in New York City, and many others. And we're seeing that the healing circles that are a product of the Community Healing Network are critically important, a critical ingredient of the solutions to some of the trauma that we see from disasters. And to bring it up to the present, I mean, since 2005, as you all know, there have been many disasters, natural and human caused. Another major one that we intervened in was Superstorm Sandy in New York City, and we developed disaster trainings and actually adopted some communities of color in some of the remote areas of New York City, like Far Rockaway in Queens and Canarsie and Coney Island in Brooklyn, engaging with faith communities there, offering healing circles in those spaces and so forth to help the community, and also being a sort of a broker, a cultural broker with FEMA to ensure that the needs of communities of color in those areas were met, whereas previously they had been overlooked. Bringing it up to the present with Hurricane Ian, we have begun to reach out to our networks in Florida to identify communities of color that were hard hit by Hurricane Ian, who were not getting media attention, and making sure that their needs for resources and services are being met, trying to connect resources that come from organizations like Unity and Disasters that have ended up trucking supplies of water and other essential items to some of these communities who otherwise would have been forgotten. And so, there's really, I think, an important role for all these concerned individuals of different disciplines to, put their heads together to figure out, what can we do in this moment? How can we advocate for these communities and make sure they get what they need and call attention to them, even when those cameras go away? I also wanted to mention the Buffalo shooting back in May was another human-caused disaster that the All Healers Mental Health Alliance was engaged with that community in addressing the trauma in the aftermath. And the Community Healing Network was the first, to step forward to offer their emotional emancipation circles and Ubuntu healing circles to help to deal with some of that pain. And so, these collaborations have been critically important with the increased frequency of disasters that Black communities are facing. Dr. Christensen mentioned Flint, that Flint water crisis. We also intervene there and work closely with Flint leaders to just devise strategies for amplifying their needs. And I mean, to this day, I think we're going on 8 or 9 years. Some of the members of those communities still do not have clean water and are, relying on bottled water. So there's so much work that needs to be done. But I think having this organization of organizations and leaders of all different backgrounds, disciplinary wise, coming together is so critical, no matter what part of the country. And even, internationally as well, we've intervened after Hurricane Dorian in the Bahamas as well.
Yeah, I do want to speak to the collaboration and the collaborative spirit. Community Healing Network is a very proud participant of the All Healers Mental Health Alliance, and do what we can whenever these human-made and nature-made disasters do occur. But a lot of what we do is to try to figure out how do we ultimately get rid of this disproportionate impact.
Right.
Human beings suffer. Human beings have problems. Our goal is to make sure that we, as people of African ancestry, can have ordinary human being problems and not the problems that come with being, a centuries-long oppressed group of people who've been dehumanized by the lie.
And that's where I think our last meeting ended on Sunday, because wherever we are, first of all, we're not prepared to even respond to the disaster. We're under-resourced generally to begin with. And this is something that has continued. We saw it in Katrina, but it has continued to today. And so we really need to make sure that we can do what's necessary to build the kind of resiliency we need. And I think at the base of that is dealing with the lie.
And I think that with that lie, which is so profound, that I'd like to know how to communicate that lie to young people, and frame it as something that we need to not be afraid of, that has been, in fact, a lie. And I don't know if there's a softer word of using to help frame that, but to be able to help them begin to navigate, particularly if they're in their school systems and they're experiencing racism among the student population, or even among their teachers, or if they're in their first jobs, out in the community, their summer jobs, and they're experiencing that. Or in some cases that I've heard, if you're seeking mental health treatment, and in that process, you are no longer with someone that looks like you as your mental health provider, but you're with someone who has been put in a position of saying you have got these mental health issues, and therefore put an indictment on the family, or put an indictment on the school system, or whomever, because of that lie, that intent to oppress at any opportunity in any way, shape, form, versus serving. So I'm interested to understand better how that conversation continues. We have just a few seconds before we take our first commercial break, but because this is where it's going to start. If we can get that mindset change, we can get those images reversed. If we can, dare I even introduce the name, very controversial things that happened recently with Candace Owens and Kanye West, and some statements that she made that some may actually agree with, on the T-shirt of the White Lives Matter. We've heard it all. So when we come back from our break, let's start with those conversations, because that's our future.
And the Black folks that sit behind Trump at his rallies.
All of them. This is America. So we're going to be right back. This is the Health, Wellness, and Lifestyle Program with Linda Dorman and Dr. Donna Christensen, with our wonderful guest today, Dr. Prem, and attorney Eric, and we'll be right back.
Metro New York's port services are currently constrained and challenged in facilitating the handling of international cargo. It's time for a whole new ballgame. Just 55 miles north of the city, Stewart Airport, closed during the base realignment, is an underutilized resource that could be maximized and bring growth to the area and relieve New York City. It's an ideal place for a thriving supply chain center of regional excellence called SCORE. We intend to support the New York and New Jersey Port Authority's commitment to the New York International Plaza, putting it at the forefront of a transformation of regional global trade, telecommunications, and economic growth. A logistics-based regenerative smart city that supplies an interactive platform of data and document interoperability to optimize resources. SCORE will transform this location into a thriving hub that can process and distribute cargo via various methods of transportation, elevating it to one of the world's best intermodal ports. We aim to build a cybersecure network operations center that enables customers to share data in real time across the supply chain and across the whole region, utilizing eco-friendly practices to keep things running efficiently. And it doesn't stop there. Not only will SCORE develop high-speed wireless networks in a data-driven city to improve logistics and facilitate international trade, it will also create critical infrastructure for regional economic development. By optimizing the business environment, attracting startups and investment, supporting the development of high-value industries such as medical, education, technology, and hospitality, creating new employment opportunities for the region. SCORE will inject vibrancy and inspire prosperity in an underutilized area to develop a greener and more livable smart city that thrives, bringing excellence to the Hudson Valley. It's a game changer. Visit IC Logistics to learn how you can support this SCORE economic development initiative at Stewart Airport.
Well, welcome back. We're very excited to have this very, very charged conversation. And we appreciate the fact that we can have this conversation in this platform. So where we left off before the commercial break was the discussion of how do we convey this message, the lie, and then juxtapose that into the mental health so that there is some connectivity that young people can understand. I'm feeling this way. I'm behaving this way. The situation is happening to me this way. I'm not imagining what I'm imagining. And I'm angry and I don't understand why.
Yeah.
How do we?
You know, we've had the opportunity to share this notion of the lie, and it really is important to call it out as the lie. I mean, when we started, a lot of people were like, "Ooh, that's so harsh. How about myth and the notion, idea?" No, it's a lie. It's a lie that was told deliberately to erase the truth of Africa's rich history, to take advantage of Africa's resources, the richest continent on the face of the earth. And so we do a very simple presentation. We say, our history started long before the horrors of our enslavement. And Africa was the richest continent on the face of the earth then and now. And the lie was told essentially to overdevelop Europe and underdevelop Africa, to enrich Europe and the Western nations. It's that simple. There were other, I assume, psychological needs for this line. But we do a very simple presentation, and usually after, and invariably actually, the young people say, I wish I had known about this 5 years ago, when I was 10, when I was 7, right? Because it opens up so much of an understanding of why it is that not only they are where they are, but why their parents and other Black people are where we are. There's no question that there are a number of people who've made wonderful advances who are people of African ancestry. But on the whole, we've got to come up with some kind of notion that it, explains the dehumanization of African people and the underdevelopment of Black communities all over the world. And this explains it because it's the truth.
And, Dr. Prim, it reminds me of this conversation I had because I have adolescents, so they know everything. And it was very sterling conversation around social media and the impact right now of social media on mental health among that population. But what also strikes me is, what have we done? How do we help ourselves in addressing this issue from a mental health perspective? Because I've seen all kind of things. And I think what Attorney Aird is saying is so true, and putting it into that context for me personally, and calling it out is a lie, and keeping it in the forefront of thinking about it in those terms, it gets me inspired and active in my mind. And then hopefully that will translate into activity. But when we come into the mental health arena, how do we tackle it from that perspective?
Well, I'm wearing a different hat now in my work with the Steve Fund, which is focused on the mental health of young people of color, including young people of African descent. And what we do is really kind of lay out the case for why we as a society need to pay extra attention to the mental health of young people of color, given how much of a hazard that racism is and how it shows up, throughout the lives of young people, whether in high school settings, with
Even
them
elementary school.
Yes.
Sure. I was just going to give an example. Throughout K through 12, when a Black youth or other person of color may have some behavioral challenges in the classroom, rather than being understood as having a mental health need, they're often punished harshly and end up going into the juvenile justice system. And whereas, white children are not responded to that way, there are very stark disparities in how those behaviors are handled. And then, throughout life, for young people and going on into later stages of life, the experience of racial microaggressions and macroaggressions, racial profiling, et cetera, that occurs in higher education and in the workplace, very often isolating people of color, including young people of color, and affecting their mental health in a negative way. And so what we do at the Steve Fund is to raise awareness of the realities of these negative forces and how to overcome racial trauma and heal. We also educate teachers and faculty, as well as employers, because this is really an all hands on deck moment. And I will say that in the past couple of years, with the disproportionate impact that COVID has had, with losses of life in communities of color disproportionate to the white community, as well as the succession of highly publicized acts of violence against unarmed Black people that we've all seen, George Floyd, Breonna Taylor, et cetera, that this has been a time where all of these things have been brought to a head, particularly for young people. And so I think it's so important to underscore the lie, to underscore the reality of racism and the impact that it has, despite all of the politics and even on the local level, pushing against that, trying to erase the reality of that history, and then making sure that people stay grounded in their cultures, which is also very important, very healing, very grounding for people, and also their activism as a way of responding to, because we see that as a healthy response to what has been going on. And so and I didn't mention families. Families are another group that the Steve Fund focuses on as well, because it's not just the young people themselves that we focus on, but those who support them and engage with them, and to know the resources that are out there. There's been a great proliferation of mental health resources offered by Black and other people of color. And, and I think with COVID, there's been the emergence of, a plethora of telepsychiatry and telemental health, so that people can access mental health services wherever they are, sometimes even on the phone. And so this has been a period of access for mental health greater than ever before, at a time when we've needed it the most ever.
And Dr. Prim, I can say, given my, like I said, I'm a single mother of two young teenage girls. I can assure you that even still, with what we do have is this vast resources, it's still under-resourced significantly. It's quite remarkable. Here in the DMV, District of Columbia, Virginia, Maryland, I live in Maryland, we just opened up a 16-bed facility, 16. And we're sorely, and that's for adults, that's not even pediatric mental health. The hospitals that are nearby that are full, an amazing history of mental health support. It stands to reason, excuse me, that their staff may need to have an all staff mental health break and retraining, because then you have a great deal of issues there. My point is that there's so much that we do have, but yet we have so many gaps. And if you're not in a position to afford them, to go to very expensive facilities, to have your child go out to the wilderness camps and the Christian mental health camps, or whatever, there's not enough that's available. I'm so glad to hear you say also that some of the outreach has been to the teachers. And I think when we talk about public policy, do we make it even mandatory that along with your continuing education that you become a mental health first, that you take mental health first aid, that you're in a position to understand because you hold the credential, you have the training. I don't know if that's a policy. To me, it seems like we need to really get it to that stage. Do we have, within the ecumenical community, yes, we have ministries that are counseling ministries, but do we really have them to the point where they can provide that level of service and not come into an issue with their insurances and, with their licenses, that we hold their hand through this process? There seems to be some policy work that can help us close the gap, because I can see the gap in my own community and my own children's high school. They can, at the high school level of 2,800 students, there's just simply not enough. And there's no mandate really for it. There's options and opportunity, but it's not something that these children have a right to, or even be mandatory to go into. Of course, like even a curriculum on how to overcome or understand or be aware. They call it government, but we know that's not what we're talking about here. So
I'll let them answer. I want to go back to something else, but you might want to answer that, and then I'll jump in with my comment.
Well, I was just thinking two things come to mind. One is the Biden administration has put a lot of money recently into school-based mental health services, and so I think, Linda, that speaks to your concern that there's going to be a surge in training for teachers and social workers and others to have a greater presence and a greater capacity to serve the mental health needs of children in school, because as we know, if it's not offered in school, there are some children who won't get mental health resources at all. And so I think, there is that awareness of the need for more mental health resources for children and young people in particular.
And I think the underlining the need for resources that are culturally attuned, historically accurate and aware, that really help young people to understand how we got here. It's really very, very important.
I wanted to just piggyback on one part of what Anel had said before about the activism. We have, because this has been so ingrained in society's institutions and systems and everything about our daily lives, we've kind of gotten used to kind of just dealing with it.
Mhm.
And that has so many adverse impact on our general health, our well-being, physical as well as emotional. Even some are finding that it's affecting the genetics and passing vulnerabilities on from generation to generation. So it is not only for our mental health, but to reach the goal of 2030, we need to fight, in a way, fight back. We cannot just
Absolutely.
internalize this and try to go through day to day dealing with it.
We're amazing. We're amazing at surviving as
Really,
people of African
but it's
ancestry.
killing
We're
us.
amazing. And we feel that we deserve to survive. And our view is that we deserve to flourish, that our children deserve to flourish, that we need to deliver to our children a future free of this lie so that they don't have to have. This is not we're not living in a state of nature here. Nature does not demand this. We demand, and we must demand, that our children, by a date certain, right? So people look at us and they say, 2030. We actually had someone say, well, there's no way that that can happen. Really? There's no way that that can happen? If we make it happen, it can, it must happen, because it's debilitating. We don't deserve to live like this. It's really, really hard. And we're in a situation where we're proud of ourselves, that we can survive, that we can make it. No, as human beings, we deserve more, and our children deserve more.
Exactly.
And so our
the
view is,
mindset we need to get to.
yeah, our view is we've got to figure it out. We don't, and we can figure it out because we don't believe we're inferior. We know we can figure it out. And so the question is, how do we come together? Our emotional emancipation circles are spaces where we come together and try to figure out, okay, how was I personally affected? Right? At the end of every emotional emancipation circle now, I don't know if you've been through one lately, everyone comes out with their own personal emotional emancipation proclamation, right? Because nobody can give us our sense of freedom but ourselves. So we actually write it individually based on our own personal experience, based on our own history. And Nola's history as a Panamanian whose grandmother was Barbadian, but who did not like Black people. So Enola has to deal with that in order to be able to empower herself to do the work of freeing her own children. And then once she frees her own children, then she has to figure out, how do we all come together and free all of our children? Not just here in the United States, not just in Panama, but globally. But the exciting thing that's happening is the collaboration that's going on all over the world now. I mean, there's a grand reparations movement that's afoot all over the world. Everybody's talking about it. Black people all over the world are talking about our need to be free and to be healed. And so that for me says it's going to happen. The question is it going to happen sooner rather than later? And I think we need to make sure that it's sooner rather than later. And that's the idea behind our deadline.
And what's interesting to me, and this is maybe an interesting conversation for a whole nother day, but I often wonder about the hate that is so visceral to the African-American who's married into the Norwegian royalty family, the American Meghan Markle who's married into the British royal family, and the visceral hate. I mean, when I say down to the spots on her shoes and the criticism, I can't fathom how one human being can absorb that and continue forward and move forward adequately enough. And it feels like those are opportunities for this social ill. And I don't know if it's all white people, but let's just say our sisters and brothers from another mother, there's something there that has risen. And I don't know where it has risen from. I know it's always been there, but it has become so unleashed. I don't know if it's the last president that unleashed it to the degree that it almost became normalized. All of a sudden, the terminology Karens and Kins became, to the point where, Caucasian individuals use it against Caucasian individuals. Is it in our music? I mean, we've got so many layers and so many places that we almost have to get to understanding not only that, yes, we know the history and where it came from, the lie, but how did it come into modern times such that it is where it is now? Because the fear of deciding who your doctors are going to be, I have a fear. I need my doctors to look just like me, and not because of skill set, but because I don't want to be in the grave because someone has made an intent on harming me in the medical environment. Because they don't,
or they don't intend it, but because of their predisposition, they can't help it.
And it's actually even now baked in, we find, into how the algorithms that insurance companies and hospitals use as to what kind of treatment you get.
Exactly.
At least we know about that
it's
now.
So insidious. That's so exciting, right? So that we now know that it's baked into our algorithms. Now the question becomes, how do we get it out? And for us, anti-Blackness is very big. It's a big elephant. But that's why we feel it's so important to break it down to the root cause, the lie itself. Mm-hmm. You can actually do a systematic audit of the lie of white superiority and Black inferiority in every system. It'll be painstaking.
Every.
You can grab that thread and unravel it because you now know what it is that you're looking for. It's this notion of the lessness of the humanity of Black people and the superiorness of the humanity of white people. And we talk about white supremacy, but white supremacy is a different animal. It wears a white coat and it's horrible, but white superiority and Black inferiority, it runs through every single system that we have, no matter the disposition, no matter how nice people think they are. It's just part of the air that we breathe. And so in order to get rid of systemic anti-Blackness, we have to go after that lie.
And do we think about it and bring in certain voices that have carried that lie to actually help to dispel it? Because I know that there are many, many, many supporters, particularly those who have biracial children, who have married into biracial relationships, who hopefully are remarkably sensitized to the plight of their children enough, or their colleagues or their friends, where they really feel like they at least understand it. Is white supremacy also a disease state? Do we, not that we, I mean, can we say that as well in this conversation?
I'm not a doctor, but I'll say it. I said I'm not a doctor, but I'll say it.
So then we've got these opposite poles, not one to the other, because they're competing and they're damaging to the broader society, is what I think we're also trying to understand. And it's manifesting itself in our mental health breakdown, of which COVID certainly brought it out. Our last administration, the policies brought it out. The attack on the Affordable Care Act that Dr. Christensen and others were so critically involved in getting passed. And we haven't had any replacements, because remember the campaign promise was a replacement that works for so many people. We're still here with it. And interestingly enough, I don't hear much reference to it being Obamacare. I do hear a lot of reference to it now in its correct term, the Affordable Care Act.
Right.
So
we have about 9 minutes left. Do we want to?
No.
Yeah, I know it's going so fast.
We have so much to unpack. No way.
I know that AMHA has members all over the country, and we usually look to those individuals that live in Florida or North Carolina or the Virgin Islands, to lead whatever your response is. Does the Community Healing Network have satellites across the country as well?
Well, we have connections, I would say. We're a very small group of people. We have connections. And I say, All Healers Mental Health Alliance has been phenomenal. Dr. Prim has been phenomenal in helping to support and spread the word about the work that we're doing. The Association of Black Psychologists, our primary ally. We really developed the Emotional Emancipation Circle with them. We wanted to make sure that it was psychologically sound. And we also wanted it to be African-centered, because we feel that it is very important that we reconnect with our Africanness, right? In order for full healing to happen, we felt that. And so that has been really very important to us. That alliance, that collaboration has been crucial. And we have alliances with many people, but we don't have any formal, and organizations, but no formal linkages. But we think it has to be kind of natural and organic.
But just to add, there are emotional emancipation circles that have gone all over the country. I mean, every major city, all over the world.
And I have to name someone, Dr. Cheryl Tarwede Grills, who was the person to whom we appealed when we went to the Association of Black Psychologists to ask them to help us develop this process. For a while there, she was Carmen Sandiego, traveling all over the world, planting seeds for emotional emancipation circles. The challenge is having the resources to develop the infrastructure to really scale and really support. And we've not been able to do that. We're in the process now of really, sort of even building out a staff in order to be able to create a foundation for long-term sustainability and scaling.
Well, it sounds to me that we need to connect you into Mackenzie Scott, I think it is, who Jeff Bezos.
I heard about that this morning.
Billions of dollars and
someone tell. Yes. Tell her about all the Black people who are working to get our lives back together. I was in a meeting yesterday with somebody. We were listing all the problems we have as a people. Yeah. All I could say was, these people, this is really devastating.
Well, it is. And let's make sure that we can get some websites to our listeners and our viewers, because we want them to connect in while we still have some time.
And
Dr.
I was trying to get to the emotional lunch breaks that you have every week too.
Oh my goodness. Well, then we just have a part 2.
Tuesdays at noon. Emotional lunch breaks, just a time to come together and be together, depending on what the topic is. We don't know. We've been working on microaggressions, right? When the microaggressions come, what do we say? We can be prepared to bat them out of the park, without having ourselves touched at all. The idea is, how do we prepare ourselves emotionally so that we can understand how the lie operates and be able to deal with it without having it touch us as they come at us? So that's what we've been working on this week. Jan Berger is our community manager and facilitator for that. It's Tuesdays. If you go to our website or if you go to Facebook, you can sign up.
Tell us your website.
And that's Community Healing Network, right?
Tell us how
CommunityHealingNet.org.
Say that one more time.
CommunityHealingNet.org.
Community Healing Net.
We're going to do this, y'all. I love the collaboration. I love the spirit. We're going to do it.
Absolutely. And your website, Anel?
Yes, the website for All Healers Mental Health Alliance is allhealersmha.com.
Thank you. Thank you so much. We really could have gone on for another hour, but our time is.
Thank you for the opportunity.
Yeah, thank you so much. It's been a pleasure.
We shall have part 2, because this is such an important story to tell and continue the dialogue around. And so this concludes our Wednesday Health, Wellness, and Lifestyle here with Linda Dorman and Dr. Donna Christensen. We appreciate you both. Have a great afternoon, everyone. Be well.